Hi, Susan. It's great to see you again. How have things been going lately?
Good. I have a new friend. His name is Tim. We work together. He's really nice.
Well, that's wonderful. What do you two like to do together?
We go for walks after work and get pizza. We like the same things, and we laugh a lot.
That sounds really fun. I'm glad you found someone you enjoy spending time with.
Yeah, and sometimes we kiss. Is that okay?
Thank you for sharing that with me, Susan. It's okay to talk about relationships and feelings here. Would it be okay if I asked you a few questions to understand how you feel and what you know about relationships?
Okay. I want to ask a question, but I don't want to get into trouble.
You can ask me anything, Susan. This is a safe space.
Okay, Tim and I want to try, to go all the way, but I don't know if I need to take a baby pill.
Well, thank you for trusting me with that. It's important to talk about how to stay safe and make good choices. Can I ask what you know about sex and having babies?
If you do it, a baby can happen. That's all I know.
That's a great start. Let's go over some information together and you can tell me if it makes sense. Then we can talk about what birth control options might work for you if that's what you want.
Okay, but I think maybe we should call my sister Beth.
Of course. It's important that you feel safe and understand things clearly.
Hi, Susan. Is everything okay?
Yeah, hi, I'm at the doctor's office and I'm talking about what I need so that I can go all the way with Tim.
Susan, I don't think that this is a good idea. You're not ready for that yet.
You talk to her.
Hi, I'm Leah, the nurse practitioner. I hear your concern. It's important we protect Susan and also support her autonomy.
She's not capable of making those decisions. I have medical power of attorney. I want to be involved in every appointment.
I want to make sure we follow both the legal requirements and what's best for Susan's overall well-being.
She doesn't understand. She needs to be protected.
Thank you for sharing your perspective. I agree. I would like to discuss placing an IUD, intrauterine device. This can be done in a gynecologist's office and would eliminate the need for her to remember to take medication every day.
Okay, that makes sense. It's just hard for me to think about her being ready for this. Yes, we can set up an appointment for the placement of the IUD.
Okay, thank you. I'll have my office call. Susan, thank you for being patient. I want you to know that your voice matters. We'll work together to make sure you feel safe and supported and that your choices are respected.
Okay, because I still want to learn more and make good choices.
What's the chicken across the road?
Why did the chicken cross the road?
Chicken aside!
I would describe it as needing a lot of assistance. She's been asked since she was probably a freshman in high school, what are your goals as far as independence and, living situation? Is that to live in a supported household, like with other people like you with assistance, or is it to stay at home with your mom and dad? And consistently her answer is to stay at home with mom and dad. So it comes down to a lot of following directions. Mm-hmm. Some people with Down syndrome and intellectual disability, I think, can live pretty independently, but Carmen, she needs a lot of support. Just this morning, to wash her hair. I have to scrub her hair for her. She needs a lot of help. But she is also very capable. She can do a lot of things at home.
So I went to a first year prom, and I had to get ready. And my ex-boyfriend kissed a girl at prom. So
She had a boyfriend, and they would do things. It was obviously, the parents would bring them. They would go to the movies, out to dinner, different things.
yeah,
And they were definitely romantic. He far more than her was interested in sneaking off to the basement. Some kissing, definitely. I think at one point he had your shirt off. Your brother went down to check on you, and that flipped him out.
no. I think it was his hands over my bra, over my shoulders, and kissing.
And kissing, yeah.
And just over my bra.
But what she's describing was they went to prom, and while they were at prom, he kissed another girl. And he said, I couldn't help it. And Carmen was highly offended. After prom, my husband drove them to his house. They were going to go out for ice cream. That didn't happen. And she got out of the car and she walked into the house and she told his mom. And that was the end of it. They were done after that.
Yeah.
So she's talked about some other fellows from time to time. Since then, that was a year ago, I guess.
Yeah.
Yeah. So, but nobody really has kind of filled that role since then. We've volunteered to chaperone events and stuff, and you got to do the bathroom checks to make sure nobody's, stowed away doing what they, what their urges tell them to. So I wouldn't say that it was unexpected. We want her to have the full range of emotion and live her life, and, romance and sexuality are part of that. We have to be careful, obviously. And, she's a very trusting person and doesn't quite know what all that's about. So, to have to guide her through that it's a special role that we take seriously. Mm-hmm. I think it's just a lot of open communication. In supporting Carmen and deciding what is good and what is bad, I'm not sure that I would use those terms, good and bad. What is appropriate, what is, good for her, I guess. For example, talking to strangers, she has no sense of stranger danger. Everybody is a friend. She loves ice cream. If you're at Graders, she's going to approach you. And in particular, like the biggest, scariest looking dude in the room, right? So it's just talking about that, and then that constant overseeing of, who she's interacting with, checking her phone. She's got 2 younger siblings that they're 19 and 17 respectively, and they follow her on social media to make sure she's not posting naked images or anything, because if she sees other people doing that, she would do that too. How to approach intellectual disability as a provider, I think involves what not to do a lot. And one of the assumptions is that they're childlike, and they're not. They are an adult, again, with the full range of emotion, the full amount of desire, and we can't discount that. And I think that is often what is done. In some ways, Carmen does present childlike. She needs a lot of support. She needs a lot of guidance. But she is an adult. She has her rights. Some families with adult children, when they turn 18, they have them sign their rights over, and they make a big deal about it. They post it on Facebook. They make a video. Carmen has her rights, so she can refuse treatment. In certain circumstances, we could override that. But yeah, just allowing them to be the adults and access care in a way that any of us would want to is what's most important. We do allow for as much independence as possible. She, when she goes in to get her teeth cleaned, I don't go back with her. She does that all by herself, even to get a haircut. Here's your card, go and tell them what you want, you know? So she wants to order her own food going through the drive-through.
Yeah.
You know, all of those things are important to her. Resources for adults similar to Carmen with, you know, mild to moderate intellectual disability. What I see is that if you have a Down syndrome diagnosis, you have tons of support. People know what to do. We have the Down syndrome of Louisville. If you don't, you have autism or some other, you know, idiopathic intellectual disability, they don't have that support. So I wish that there was a resource that was more encompassing, that everybody could kind of know what the resources are, navigate the Medicaid waivers, Michelle P. waivers, regardless of what their diagnosis is. And our system lacks that. Helping Carmen to navigate privacy is definitely a challenge because she's an open book. She'll tell you it's her birthday and how do you like my nails? And, you know, so in regards to her sexual health, one of the things that I learned through the community, you know, in navigating women with Down syndrome or intellectual disabilities is how to manage their period. So Carmen had an IUD inserted pretty early on. She was just grossed out by the whole process of things, like, you know, didn't understand it. So under sedation, she had an IUD. So now she doesn't have a period anymore. It also protects her should anything terrible ever happen, you know. I'm not sure outside of the community that people know that that's a really good option for our people. The knowledge of the resources that are available, I think that is where there's a disconnect so often. I have a patient with Down syndrome who's 28, and her family has been on the Michelle P. waitlist for 8 years. I mean, they should have applied for that when she was 3. And I'm like, did you know about it? And they're like, it kind of just wasn't on the radar. She didn't need those resources then, and now she does. So, you know, it's... I don't know how to close that gap of knowledge and understanding of what resources are available. I think it is important to push and nudge to attain all of the resources that are available. This is why it exists. Why would you not? And I think some of that is stigma, and we just want to minimize that, you know, that it's okay. You know, no matter what the diagnosis is, whether it's Down syndrome or toenailitis, it doesn't matter. We want to be able to effectively treat the symptoms and provide the case management that is important so that they can be as independent as possible if that's their goal, and know what those options are, or support the family in the home, which is what we do with Carmen. She has a significant income between Social Security and the waiver. She contributes to our household. And so when she wants to get her nails done, yeah, there's money to do that, you know? So just making sure that there is the understanding and the education on that. As far as hoping for your future with relationships and intimacy, I hope that it's fulfilling and safe. Yeah. So she was happy when she had a boyfriend. She felt like she was included in social situations that she enjoyed. You know, her brother and sister have had boyfriends and girlfriends, and she could relate with them. She enjoyed the independence away from our central family unit when she would spend time with him and his family. So I hope she finds something like that again. Carmen has never expressed any sexual intimacy feelings. Now, that's not to say I won't find her naked in her room dancing, you know.
I like that one.
But, you know,
You can laugh, you know.
currently is not on the radar. You know, as she ages and, you know, has a relationship that goes deeper, maybe that would be there. But so far, that's not anything that she's talked about. Advice to other parents would be to just listen with an open heart and an open mind. Remember that this is all normal, natural development and growth, and it should be supported and not squelched. Don't try to take it away from them. It's an important part of their life. And to try to be supportive and allow, a safe situation and an environment for them to get to know a partner and celebrate that with joy. I own my own practice, and I tell patients all the time, I'm going to treat you like you're my family. So the message is the same, you be straight with me, I'll be straight with you. If I notice that there are, parenting things that seem off track, I'm going to tell you. I'll at least give you my perspective. And in this situation, luckily, I have good perspective, because of this one right here. So, whether they heed that or not is on them, but at least they're hearing it from somebody that knows, not only from a clinical and education standpoint, but living it every day as well. What would I want other nurses and healthcare professionals to understand about you? That they can listen to her, that she can be a good historian of what she experiences, what her concerns are valid, and don't discount what she says, other than getting married when she's 21.
Knock knock.
Who's that?
I am the mutton cow. Moo!
I love that